Coming up on American Medicine Today, Dr. Anthony Atala of the Wake Forest Institute returns to the program to show us the latest advancements of 3D bioprinting. What was once science fiction is now a reality being put into practice. Then, Sheila suffered an unfortunate accident that left her in severe back pain. See how the patented Bonati Spine Procedures got her back to work and living completely pain-free. Then, Admiral Kyle Kozad suffered a debilitating spinal cord injury while on active duty. Learn how he was able to overcome incredible odds and teach himself to walk again through sheer relentless positivity. Coming up on American Medicine Today.
Featuring cutting-edge science and medical innovation, touching personal stories of recovery from pain, along with political, social, and healthcare issues plaguing our nation. This is American Medicine Today, brought to you by the Bonati Spine Institute and Alfred Bonati, MD.
Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker. So the science of 3D bioprinting is revolutionizing the way tissues and organs are developed in the lab for implantation in patients. Joining us to discuss is the man at the forefront of this technology, Dr. Anthony Atala, Director of Wake Forest Institute for Regenerative Medicine. Thank you for joining us yet again, Dr. Atala.
It's nice to be with you both. Thank you.
Now, we had you on years before, but for those unfamiliar, can you kind of explain the science of 3D printing? And your team was essentially the one that was noted for inventing that idea. Is that correct?
Well, we certainly have a good team and team players that have actually played a role in the development of this technology.
Yes.
But many players, of course, with all of these technologies.
The initial idea started with an actual printer, didn't it? And instead of ink, you used tissue, or cells, I should say. Right?
Yes, that's exactly right. And basically the technology involves getting a very small piece of tissue from the patient, less than half the size of a postage stamp. We then are able to expand the cells outside the body, and we can then use those cells in a printer, just like you would use ink, but instead of using ink, we're using cells. And we're able to lay down those cells one layer at a time using these hydrogels or gelatin-like materials that we call bioinks to create tissue structures that then can have functionality.
What type of tissues and organs are you printing?
Well, really a broad variety of tissues and organs, about 40 different tissues and organs that we're currently printing. And it really is based on the strategy that we established many years earlier by using these cells and creating these tissues by hand.
Are they fully functional organs?
Well, that's an excellent question. The tissues and organs, in fact, the goal is for them to be fully functional. So by the time they get implanted, they're able to function normally. And that's what we've done by creating these tissues by hand, where we were creating these by layering the cells one layer at a time on these scaffold systems, sort of materials, if you will, to create these tissues. We were doing it by hand. We just automated the process by using the printer, but by then being able to push some of these tissues into patients.
Where do you know where the genesis of that idea came from? And then who thought, let's give it a rip and see if it works? And hey, it does. Do you know the background of how that all came to be?
Absolutely. So, it's interesting, right? We had already been creating these tissues by hand, and we were making these tissues, and we had implanted already a few of these tissues into patients. And of course, for us, the need was, can we actually automate the process? How do we automate the process? And there were a lot of, as you know, 3D printing had already been around, right? And people had been printing materials, people had been printing cells, people had been printing many different types of things. Really, the strategy was, how can we create true tissue that is going to be functional? And how can we actually make that happen in a way that's going to be reliable, scalable, and that we can reduce the cost? Because that was another one of the challenges.
When you talk about these organs and you say you've already implanted them, have they been functional, like fully functional from the onset? Did they need to be replaced or rebuilt, so to speak?
So we have it, the ones that we have created by hand, we've implanted into patients. And we have a number of these different tissues and organs that we have implanted using various strategies. And so patients are indeed walking around with their engineered organs. And the goal for us is really to allow more technologies to be able to get to patients.
What are the limitations to this technology as we sit right now?
Yeah, so, the challenge right now is for solid organs, right? We can create flat structures like skin, tubular structures like blood vessels, hollow non-tubular organs, for example, like a stomach or a bladder. But when it comes to solid organs, there are limitations because there's so many more cells per centimeter where you can create small solid structures, but to create larger solid structures is still a challenge.
How long does it take you to create these cells or organs that you are able to work with?
Yes, from the time you take the biopsy from the patient or a small sample of tissue from the patient to the time that you're able to expand these cells into large quantities and actually create the structure, that whole process is about 4 to 6 weeks until you're able to then put that structure back into the patient.
And so where do you see this technology going in the next 10 to 20 years? Sky's the limit, or, well, who knows?
In science, you never say never in science, right? Because the potential is always going to be there to expand the horizons of our knowledge. But of course, we also have to be realistic in terms of timelines. These technologies do take time to develop. And our goal, of course, is to keep accelerating the timeline so we can get to patients faster.
And any success stories that stick out in your mind over the past several years since we spoke with you last, that you could give us sort of a taste of, this is what happened, this is what they needed, this is what we made, and success story. Give us a couple examples if you can.
Well, probably, we've implanted tissues into patients at this point. So one of the newer technologies that we have been developing over the last number of years is what we call the body-on-a-chip technology, where we can miniaturize these different human tissues and organs and put them into a device the size of a chip. We can then create a human analog or a human twin, if you will. And then we can use that to taste drugs for toxicity, for drug development, or even create tumors on a chip. We can create the tumor for that specific patient. At the time that the patient takes their biopsy to diagnose the tumor, we can create a tumor on a chip, and we can then test the treatments on that chip so we can better predict what would be the best therapy for that patient.
Why didn't we start talking about that? That just sounds like sci-fi, as Kimberly and I like to say. How far you're already using that, or it's being developed now?
Yeah, we've spent about 12 years developing the system, and it's up and running. We're using the system to test a whole bunch of drugs. As you know, one of the challenges with drug development is that industry spends hundreds of millions of dollars, and 90% of drugs that enter clinical trials in humans never make it out. Because of concerns of safety or toxicity or efficacy. And therefore, this system is designed so we can help to accelerate the development of these medications.
Is there a downside to 3D bioprinting? Certainly it doesn't seem as though there would be rejection since you're taking the patient's own cells, correct?
That's right. One of the nice things about the technology is because you're taking the patient's own cells and you're using them in the same patient, you don't have to worry about rejection or any other challenges.
So basically, there's no downside to what you're doing except the length of time maybe that it takes. Like you said, the technology you're using now with the chip took you 12 years to get there. So really, it's just time is the only stumbling block right now.
Well, time and also trying to make technologies less and less expensive, so we can get them to much larger numbers of patients over time.
Thank you so much for taking the time to share how things have progressed over the years with 3D bioprinting. Thank you so much, Dr. Anthony Atala, Director of the Wake Forest Institute for Regenerative Medicine.
Thank you, Kimberly. Thank you, Ethan.
Make sure you stay tuned. Coming up after the break, a story of recovery. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented the precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect 98.75% patient satisfaction. 75,000 procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Visit askbonati.com.
Sheila McNaughton loves living in St. Petersburg, Florida. She also loves helping other people make the Sunshine City their home too.
I'm a real estate agent, and so I spend a lot of time in my car driving. We're in my office right now in St. Petersburg, but I spend my spare time, if I can, I do a lot of writing, and I do a lot of reading, and I do a lot of crafts. I work on beadwork, kind of a junk artist actually, and so people give me their extra junk broken things, and I make them into wall hangings and whatever.
But when what could be called a freak accident happened, Sheila began experiencing unpleasant symptoms and intense pain.
The first time I had the problem with all of this was I was in a grocery store and they dropped a table on my head. It really hurt and I had a lot of problems. It was just a big plastic table, but they knocked it off the top shelf where they have all the groceries, and it landed on my head and pushed my head to the side. At first, I thought I was going to be okay, but as the weeks went on, it was just really, really painful. I was having tingling all the way down my arm. I couldn't sleep at night because of that. I couldn't turn my head to drive because it hurt so much. I went to chiropractor. I had massage therapy. Nothing really was seeming to make the difference. I was just still in pain all the time.
Though the conservative treatments were proving to be unsuccessful in treating her ailments, she was still reluctant to undergo surgery. After some encouragement from her husband, John, a former Bonati patient, she decided to schedule a visit.
I was afraid to have surgery. And my husband, John, had been to Dr. Bonati several years before, and he kept telling me, this will work for you. It just hurt too much. And he finally convinced me that because it helped him so much, he knew it would work for me. And we drove up to Bonati's office, and it was wonderful. They did a lot to relieve my fear of, oh my God, I don't want to have surgery. I felt so much more comfortable after the very first visit in his office. And when I'd gone with John, it was different. I was the wife taking care of my husband. This was me going in for me, so it was a totally different experience. I mean, I felt very comfortable with him in their care, so that did help when I knew I was going to go through this myself.
The 11-acre Bonati Spine Institute campus offers all the necessary services, including clinical, imaging, surgical, and post-operative departments in one location, so a patient will never have to visit another facility to begin or complete their medical care.
When we first did go to Bonati's office, I felt like everybody was wanting to hear what we had to say, that the doctor took a lot of time talking to me. He did explain very quickly and easily and showing, this is where you're hurting, correct? And this is where you're hurting. So it was easy to understand because my looking at those pictures, I couldn't tell anything at all. But he was able to explain it very easily so that John and I both felt comfortable. They had explained that I would be awake enough so that I would be able to tell them if there was any issues going on. So that if I felt something in my shoulder, I would say shoulder, if I felt something in my arm. And I was concerned about that because I didn't want to be awake during a surgery. And it was not bad. I was really expecting it to be kind of a scarier situation, but it wasn't. And throughout the procedure, someone was always talking to me saying, you're doing really good, Sheila. This is great. You're doing just fine. If I did start to be a little concerned, it calmed me down. And they were just it wasn't as frightening as I thought it would be. I mean, it really wasn't. When we scheduled the surgery, we spent the night at the hotel in the area, went back the next morning. Everything was fine, and I was able to go back to work within a couple of days. But I remember feeling good and not feeling, a lot of pain or a lot of discomfort from where the surgery had been done.
Because of this targeted approach, the recovery process is a fraction of that of traditional open back surgeries performed at other facilities.
Actually, the recovery was great. I mean, I really immediately felt the difference and was able to do things that I had not been able to do prior to the surgeries.
Since Sheila's third and final procedure, she has full use of her neck, arms, and hands, returning to her everyday activities without hesitation.
Probably one of the biggest things that I was limited to doing prior to the surgery was just general motions of going to the grocery store and picking up the grocery bags and putting them in the car. It would have to be one bag at a time, but I could never pick them up with my right hand. It was always with my left hand. I write a lot, and because I do a lot of crafts and junk art, I really couldn't use my hand as much. It would hurt, just not function the way it was supposed to. So once I had the surgeries, I was able to drive much better because I could certainly turn my head to see what the traffic was doing. And I was able to spend longer times at my work table and doing projects that I wanted to do. And sleeping is a huge difference because I couldn't get a full night's sleep before. And now that's not an issue.
Whether you're a patient or caregiver, all of those who walk through the Bonati Spine Institute doors are treated with equal amounts of care, respect, and attention.
Having been a patient as well as the spouse of a patient, that whole waiting area, again, I think the whole feeling of you're welcomed and they want you to be comfortable, I think it makes a huge difference because being a patient, you've got a lot of people taking care of you. As the spouse or caregiver or loved one of a patient, it's a little scary on that end because you can't really do anything. You just have to kind of wait and see. So I think the way that they treat you as the spouse, caregiver, loved one is really good too because you're important. And I think you get that feeling when you're there, that they care about you and that if you need a cup of coffee or how can we help you so that you're not concerned because we're taking good care of your loved one. So overall, I think on both ends I've been on, it's a great experience. I've told a lot of people about the surgery that I had when I've talked to them about pain that they're saying my back hurts. I think the experience for me was so good that the pain relief was so incredible and the whole experience up there was so nice and pleasant and friendly that I recommend the Bonati Clinic to my friends. Once you sit down and talk to these people, you come away feeling that they do care, they know what they're doing, and the number of people who've had it done is incredible. And we actually know several people who've had it done. So whenever I talk about that, I say it's not just me, it's not just my husband, John, it's my sister-in-law, it's other friends that we know who've gone through the surgery and have been very pleased.
The recovery was pretty easy. I was able to walk around after surgery with no problem.
And when I got up off that table, it was like, like a reborn again when I was able to walk off that table and walk out and go for lunch. I went in there at 10 o'clock, got operated on. At 12 o'clock, I was walking out on my own.
We went to the Bonati Institute, and that was the turning point in my life. This type of surgery is so much more advanced, and the recovery time is so much less that it's just a no-brainer. If you've got pain, go to Bonati.
This is the honest to God truth. And was recovering, I didn't feel anything. The pain that I was suffering is gone. I can go back to work in like 3 days.
The surgeries that I had, actually, I recovered very easily from, I would say. I actually went to work the following afternoon.
That afternoon, when it was done, I actually felt so much better already.
6 days after surgery, I was back in the gym, slowly but surely working my way back to fighting, back to basically 100% of fighting. So 6 days, and everybody was in awe. Like, didn't you just get out of surgery? I'm like, yeah, I feel great. And like, okay, let's see how you do. And I was bowling with everybody, and I'm in the advanced class. So that sounds a lot right there.
First time I came in here was Monday, and today is Thursday. I've had 2 surgeries and am doing fantastic. I'm still in shock that I can walk. That's all within 4 days.
Bonati succeeds where others fail. Welcome back to American Medicine Today. So a moving new book tells a very personal story of one extraordinary service member who suffered a debilitating spinal cord injury while on active duty and how he was able to bounce back and triumph over adversity. Joining us is retired U.S. Navy Rear Admiral Kyle Kozad, author of Relentless Positivity, a common veteran battling uncommon odds. Thank you for joining us.
Kimberly, good morning. Great to be here today. Thank you.
Great to be with you, and thank you for your service to our country.
Yes, thank you.
So we wanted to talk about your extraordinary military career. You were the Navy's senior leader in the White House Situation Room during the whole bin Laden raid. That had to have been intense. Can you describe that for us?
Yeah, it was amazing. You know, I was there. I was a senior Navy captain at the time, and during the raid itself, I was the director of operations, but the senior military guy there in the situation, and you know, just a phenomenal experience to be able to see that whole thing come together over a series of, you know, very secretive briefings, very closely hold information to culminate to what the public saw with that one picture of an Air Force one-star general and the national security staff, to include President Obama, sitting around him during that historic takedown.
Why don't you take us back to the actual day that you became injured?
Absolutely. So, you know, there's an old adage that goes along something like a single moment can change your entire life forever. And, you know, for me, that happens on March 16th of 2018. We lived in a historic home. It was government housing at the time. I was the senior admiral here on base at NAS Pensacola, where we still live today. And I was the last one to go up to bed that night. And as best as I can recall, you know, really narrow steps with a very low handrail. And I'm 6'5", and to the best of my being able to piece this together, I think I fell off the second or third step. Landed on my back and shattered 2 vertebrae, T12 down to L2, so the very lower back. And, you know, can remember very little about it. I was in shock. I can remember vividly, though, you know, the frustration, the fear of not being able to move, not being able to get myself, and just not understanding that.
So if everyone had already gone to bed, I mean, did you lay there for a while? Were you able to crawl to a phone? I mean, how did you get help?
Yeah, I've got a pretty loud voice. As soon as I wrapped my mind around the fact that, you know, my lower body wasn't working, you know, I called for my wife and she came down and immediately called 911. And the next memory that I have is waking up in the ICU the next day, probably about dinner time.
And so what were you told? What was the diagnosis and then the treatment?
Yeah, the diagnosis, I mean, that was absolutely life-changing. The doctor came in with both my wife and I, and, you know, I knew something wasn't right. But you know, he used the words for the first time, paraplegic spinal cord injury. And he gave us a diagnosis that based on the severity of the injury and the trauma to my spinal cord, I'd never be able to get out of a wheelchair again. I'd never be able to stand, wouldn't be able to walk, wouldn't be able to do anything that, you know, I had normally done. And, you know, prior to that, I'd spent 32 years as an active duty Navy pilot. So I was healthy. I was relatively successful, loved to be outdoors. And, you know, as far as I was concerned, nothing good in front of me other than my Navy career. I loved wearing the uniform. And, you know, then the imaginable happened.
I can't imagine being in a situation like you were in. So speaking of the title of the book, Relentless Positivity, how did you dig within and find that determination to not let it drag you down and send you over the edge?
Yeah, I knew right away that, you know, I had a decision to make, and, you know, I could either lay in bed and feel sorry for myself. And, you know, a lot of people in a similar situation look behind and say, why me? Why me? But, you know, I really took this as an opportunity to figure out, you know, what's my new purpose? What positive can I make out of this? And so that's exactly what I did. My motivation was my faith in God, my family. And, you know, the very first time I went into physical therapy and they pulled me up in this very mechanical machine. So I had seat belts, chest bands on, I had things around my waist, and it pulled me up out of my wheelchair. And for the first time I was standing, and, you know, I had this crazy notion that, hey, I want to return to full duty in the Navy. And those things, you know, kind of joined together to be my inspiration to, you know, to take my first step, to teach myself, you know, just like a 1-year-old, how to mechanically walk again when I had no feeling below my waist. And, you know, I didn't stop with one step. I became a step counter. I used a walker to a point where, you know, after 6 weeks of physical therapy, I was able to return home. And to the point where I am today, I was able to continue to serve on active duty as the Navy's, you know, most senior handicapped officer for 2.5 years and retired in 20. But today I use a walker most of the time. I use a wheelchair when I go through airports. I can drive myself to work, and I work full time as the CEO of the Naval Aviation Museum Foundation. So
Awesome.
life is good, and I feel like I've got a lot to give back.
So how much motion do you have? I mean, obviously you just said that you can walk fairly well with a walker. How much feeling do you have in your lower extremities?
Absolutely none. So I've taught myself to pivot, to shift, to do things just from muscle memory. But you could drop a brick on my foot and I wouldn't know it.
What about what you went through made you really want to give back to the public?
Well, I started with adaptive athletics through the Navy, and I was the senior member of the Navy's DoD Wounded Warrior Team in Tampa, Florida a few years ago. And, I got into this position where, I felt really empowered, and I felt like I had a positive message to tell other people like me who had suffered catastrophic injuries or illnesses. And, I've done that over the last couple of years, just on an individual basis. And, I've got probably 20 folks that I work with, that I mentor. But I saw this book as an opportunity to, potentially reach more lives. And so that's why I set out to write it, just so I could share that story and hopefully motivate and inspire other people who are going through circumstances in their life. And those circumstances don't have to be significant injuries like mine. It could be something like, the kids are having trouble in school, or you're moving to a new area and you just feel like you're isolated, or maybe you're a cancer patient. So, to try to motivate and inspire others going through, their specific challenge in life.
Yeah, I wanted to ask you how important that is to have a strong support system anytime you have either an injury or an illness or anything like that.
I think so. I mean, for me, that was super important. I had my family, and I had my Navy family as well, and the community of Pensacola really rallied around us to help us. And so, I look back to my career in naval aviation, and the toughness that imbued in me, just in the fiber of my body. And so, all the proceeds for this book go back to the Naval Aviation Museum here in Pensacola, Florida, so we can tell stories about not people like Kyle Kozad, but stories about people who have been common men who have done uncommon things in the service of our country. So real heroes.
Thank you for sharing this book with us and giving everyone inspiration. Retired U.S. Navy Admiral Kyle Kozad, author of Relentless Positivity, a common veteran battling uncommon odds. Thank you for being on the program.
Great to be here today. Thank you.
Thank you for watching. Check us out anytime on the American Medicine Today YouTube page, and we'll be back next Saturday, 4 p.m. Eastern, right here on Newsmax. If you have any comments or questions, contact us at the number below. You can tweet at Dr. Bonati using hashtag American Medicine Today or hashtag AMT. We would like to hear from you.